My name is Dr.Zimin. I'm a founder of Dr.Zimin.com. I'm a medical doctor and naturopathic doctor. Today we're going to be talking about very beneficial herb. It's called Pyrola rotundifólia. It means that it has round leaves. So part use leaves. Main facts about these herbs. So these herbs from traditional Chinese medicine. And the second, that it has strong antiseptic properties because it contains arbutin, homoarbutin, all this stuff. So recently there's a huge problem of drug resistance, resistance to antibiotics. And this is a huge difference how we apply herbs in contrast with antibiotics. So if we have a short-term aim just to kill bacteria, we take antibiotics 5 or 7 days consistently. But all chronic conditions they are chronic. So what does mean chronic? Chronic is from 6 months to 2 years. So we cannot apply antibiotics. We cannot take antibiotics all this time. So that's why only herbs can be used, beginning from 6 months to 2 years of consistent taking of these herbs. And also I want to focus on chronic inflammation. So it's relapse and remission. It's relapse of disease and remission. So in acute stage, when you have relapse, of course we should take antibiotics. But when you have remission, of course herbal drugs are more appropriate in this condition. So it's like to exemplify these chronic inflammation processes. And here we have the overview of indications for Pyrola rotundifólia, so female inflammatory diseases. Pýrola has some kind of affinity to reproductive organs, female reproductive organs. So the second indication, inflammatory diseases of the bladder and especially chronic prostatitis can be very well treated with these herbs. So the third is female infertility due to chronic inflammatory conditions, because on the timeline, it's sometimes chronic conditions are previous to female infertility. And also, I want to make clear for you that Pyrola rotundifólia is very good in combination with other herbs, because when it's work alone, it's not so effective. So we should combine with other awesome herbs. So the first is white willow, the second is European aspen, and the third is meadowsweet. And meadowsweet contains a lot of salicylates. So if we can combine, for example, Pyrola with white willow or Pyrola with European aspen, it can be in infusion especially, or it can be even tinctured, because tinctures is one of the beneficial forms of pharmaceuticals. And a few words about preparation. So first of all, infusion, 1:50 ratio. What does it mean? 1 part of herb and 50 it's water. The second, the tincture, 1:10 ratio is acceptable. 1 is herb and 10 is alcohol. So 5 to 10 milliliters a day is sufficient dose and sufficient daily dose. And contraindications, individual intolerance. Just I want to say that it can be to every herb, but it's not so frequent. If you like this video, please press subscribe button, and in the next video we'll know more about herbal remedies, nutraceutical and cosmetics.